thiazine tranquilizers. So these are drugs like acepromazine. So their mechanism of action, so they work on anti-dopaminergic action in the central nervous system, depresses the RAS, and it suppresses the sympathetic nervous system. They are also antihistamine drugs. They are antiemetic. They are very long-acting, and they have no analgesia. And so their cardiovascular effects, this is super important to know about acepromazine. They have marked vasodilation. So it's blockage of the alpha-1 adrenergic receptors in the vasculature, which makes vasopressors less effective. This is why I never pre-med with acepromazine. For me, it's like, why shoot yourself in the foot? The latest studies that have come out in hypotension for dogs and cats under anesthesia is that 20 to 30% of dogs are hypotensive and 40 to 60% of cats are hypotensive just under general anesthesia. So adding acepromazine to a pre-med can just potentially augment that hypotension. So I will never pre-med with acepromazine. There are people who do at low doses and everything is totally fine and there's nothing wrong with that. For me, I would rather pre-med with a drug like dexdomitor that I know is reliably reversible and is much more short-acting. Oh, but they're also antiarrhythmic. They've got a lot of unique qualities. And this is also why you can never use acepromazine if you're doing allergy testing, because they're antihistamine. Was there a question? Yeah. Yeah, for sure. So the question was for post-op dysphoric animals, should we give them ACE or you give them ACE? So yeah, for sure. Post-op, if you have a patient who is otherwise healthy, who is not in a state of vasodilation, meaning it's not septic, it's and not in some state of shock, then acepromazine, it can be completely fine to give post-op. I often give dexdomitor post-op as long as it's not otherwise contraindicated. It's sort of patient selection. More often I'll give cats acepromazine, and the reason for that is because a lot of cats, if they're on a fentanyl CRI or they're getting another Purmu like Hydro, they're more likely to get dysphoric and febrile. And the acepromazine vasodilates them and sort of cools them off. So I find it also can decrease the incidence of them getting febrile. But a lot of times I'll start with a dose of Dex, give that 30 minutes, like a microdose of Dex, give it 30 minutes. If that doesn't work, then the acepromazine. Yes?
If they're dysphoric already and acepromazine is not an anxiolytic,
Mm-hmm.
are you using it with something else then at that point?
Well, I guess, okay, so the question was if the patient is dysphoric and acepromazine is not an anxiolytic, then are you using with something else? Yeah, like I said, I'll always give dexdomitor first. And a lot of times this could be a patient who I have already on gabapentin TID, so it also kind of has to do with what other anxiolytics they might be on. But yes, and I'm going to pull up that study soon to show you I'll explain it further in the next slide. So our contraindications, like we just sort of talked about, liver dysfunction. If you give acepromazine to a dog with elevated liver enzymes, they could sleep for like a day or two. I've actually seen it. We have to be so careful giving ACE in dogs with either liver disease or elevated liver enzymes. Hypovolemia because of the vasodilation, inappropriate vasodilation, any coagulopathies, and skin testing, like I mentioned, because it's antihistamine, and any type of thermoregulatory concerns. So again, if your post-op animal is 93 degrees, but it's dysphoric, and you give it ACE, it's going to be really hard to get that temperature to come up. So talking about ACE some more, it's a reliable sedative and muscle relaxer. We kind of already talked about all of this. Best use post-op when dexdomitor is contraindicated. That's sort of how I use it. Dose. There's a really wide range dose out there. I have never gone over 0.02 mg per kg. And so this was a study that came out. This wanted to evaluate the perioperative stress response in dogs, and some were administered an alpha-2, and some were administered acepromazine, and they measured all of the things that we talked about in the first lecture for stress response. And the conclusions were that dexdomitor may offer some advantages over to ACE with the ability to decrease perioperative concentrations of stress-related hormones. So for me, this is like really kind of proving that dexdomitor is a much more advantageous drug perioperatively for anxiety. That being said, like we talked about, if your animal's already on TID trazodone or gabapentin, we have the anxiety under control. And maybe this patient has a type of heart disease that we don't want to give dexdomitor, but ACE might be okay, then we go for ACE. So I would never just, sort of throw it out the window completely. There are certain circumstances where I still reach for it. Our dissociative.